Hi, so I just gave a talk here at the ACC talking about whether atrial fibrillation ablation should be used as first-line therapy for atrial fibrillation or not. Presented a lot of data, although there aren't a whole lot of data. I presented some clinical cases, the patient who may need a pacemaker or an ablation, the athlete, and some of these other situations where most people agreed that ablation first line would make sense. I then talked a little bit about the tipping point of atrial fibrillation. In that, in as short as just 30 minutes of atrial fibrillation, you can have electrical changes. In as short as 5 weeks of atrial fibrillation, you can start to get fibrosis or scarring of the left atrium. So there does appear to be a tipping point. In our studies, it appears to be about 182 days. If the ablation can be done within 182 days of diagnosis, patients do well. But in head-to-head trials, drug versus ablation, there were 3, and I quickly reviewed these in these studies. The bottom line, at least in young, healthy patients, that as long as the procedure can be done safely, you're more likely to have a better outcome with ablation first. But should you really be doing ablation first? Given governmental oversight, other issues going on, we tend to prefer a drug strategy first. Now, certainly the length of that drug strategy may vary from patient to patient, but at least a drug strategy first before ablation. And that, in a nutshell, was my talk.